All right, meantime, healthcare workers and first responders across America struggling to get the critical protective gear they need in some places. My next guest jumped into action when her district needed help getting N95 masks, saw firsthand how hard it is to get a hold of some of these crucial medical supplies. Michigan Congresswoman Alyssa Slotkin is a member of the House Homeland Security Committee. She joins us now. Congresswoman, we appreciate you coming in. Talk about the process. You know, we've seen some areas where this protective gear has now come in. It appears that our healthcare workers on the front lines are getting what they need, but it takes a lot of work, as you know firsthand.
Yeah, and I say it's pretty spotty. There are areas where maybe the equipment is coming in. I still know that there are hospitals here in Southeast Michigan who simply do not have enough equipment, and I've spoken to just tons of healthcare providers who are in the ICUs, who are intubating patients every day, and they're using equipment that their brother got them or that someone lent them. So I don't think it's easy to say that everyone has the equipment that they need, but it's a bit of a Wild West scenario, particularly because so much of our supply chain on medical equipment and medical gear, we now know really comes from China. And it's been a really difficult experience going through the process of getting a hold of a guy who has relationships in China with a factory, places the order, the delays, the customs, the Chinese government getting involved with middlemen. It's really been like the Wild West.
Well, on that point, that last point about the supply chain from China, we've heard Republicans like Lindsey Graham say that they're working with President Trump to change that. The president's been taking on China practically since day one of his administration. Remember going back to the campaign. I know you don't, as a Democrat, don't agree with them on a lot, but is this something when this pandemic is through and when we feel like we finally have our arms around it, do you think this is something both parties can work on and say this supply chain stranglehold by China really doesn't make sense for America?
Yeah, I do. And honestly, I mean, I just introduced a piece of legislation called the Made in America Supply Chain Initiative. It won't help us with today, but the goal is that we will never again be hamstrung by all of our supplies coming from a foreign country when it's really so important for certain items. So I think this is absolutely an area where there's overlap. There's a bunch of Republicans interested in co-sponsoring my bill. I want it to be bipartisan because I don't think anyone wants to be beholden to another country in order to get our nurses the masks that they need. That's crazy. And I'm from the Pentagon, right? I used to be at the Pentagon, and there's a very clear Buy American provision in law on military equipment because we never wanted to depend on another country for our military hardware. We should have those same Buy American provisions on medical supplies.
Absolutely. A bottom line on your state. We've been checking in all around the country. The governor here, Andrew Cuomo, says the worst is over in New York. We checked in with Republican Steve Scalise earlier in this program. He said Louisiana is flattening the curve. Michigan, as you know better than I, has been particularly hard hit. Are you flattening the curve there?
Well, we're in our worst 2 weeks, and the truth is they just had reports come out that we've had more deaths per capita than anywhere in the country. We're at literally, hopefully, the tip of our curve, and then hopefully going to come back down. I do think some of the aggressive action that we took in this state, led by our governor, is flattening the curve. But there's no doubt that we're in the thick of it, and you just have to listen to my phones ringing off the hook from our medical professionals that they're in it right now. They're really in it. And it's traumatizing for a lot of them. Absolutely.
You just mentioned the governor, Gretchen Whitmer. As you know better than I, she's faced a lot of criticism for some of those measures she's been taking. For example, saying Michiganders can't go to their second homes. These are not rich people necessarily. These are folks going to a lake home or a cottage, as you know. They can't go to that home. Other people, as stores are being told, you can't sell paint somehow. And folks are saying, how does stopping the sales of paint, how does that help you with the coronavirus? Has some of this gone too far?
I mean, listen, I think that there will be people who are alive in a few months because of the aggressive action that our governor took. And there's always going to be Monday morning quarterbacking. Whenever you're in a crisis and you have a leader making decisions, it's going to draw criticism. No one likes that we can't go up north, and in Michigan, everybody goes up north. No one likes that we can't go to our lawn and garden stores, but we didn't do that in an arbitrary way. We say you can't go up north because if you happen to have the virus, we don't want to spread it to our communities up north. There's a medical reason for much of this. Now, it's not that we don't want people buying paint. It's that the place where they congregate and buy paint allows for more transmission. And we all want to get back to work. That is everything we're talking about right now. But we have to let the medical piece guide us, because the worst case scenario, can you imagine if we get back to work and then suddenly the virus spreads again and we have a second wave? We have to kill this thing as much as possible. And I know she's taken some hits. Obviously, she's gained in prominence, and so she's going to be an easy target. But when you're a leader, you're taking aggressive action, I think should be rewarded, not sort of Monday morning quarterbacked.
Right. Last 30 seconds we have, though. You mentioned you worked at the Pentagon. You were a CIA analyst as well. You had to work within the frameworks of the Constitution, obviously, and there are protesters now in your state saying the governor has violated the Constitution in their eyes and gone after some of their fundamental freedoms. Your response?
Well, that's their right to protest. They can certainly do that. I really hope that they stay in their cars and they don't congregate. But listen, like every other governor in the state, the governor has taken actions based on the authority that she has, just like in New York or Louisiana or any other place. It doesn't violate their constitutional rights to be forward thinking about public health. And again, think of the human beings that we're trying to help here, not just people who get sick, but the people working on the front lines, literally, of America's latest war in those healthcare communities, in the hospitals. We're trying to make sure those hospitals aren't overrun and support what we can our frontline workers. And that's who we should be thinking about. All
right. Well, those healthcare workers are heroes. We've been talking about them. You're one of the lawmakers who've been trying to get them what they need. Alyssa Slotkin, we certainly appreciate it. And we're still thinking about your state as well. Thank you.
Thank you.